Deputy Presiding Officer. I think right now everyone in Scotland is asking themselves two fundamental questions. First of all, can I afford to get ill because I don't know when an ambulance will turn up to take me to hospital or if there will be a bed for me when I get there? And secondly, that if bills have been a struggle to pay this year, what will it be like next year once the UK government help is withdrawn? This budget needed to provide answers to these two big questions, but it does not. This budget has no new plans, no new solutions, no new answers to these big problems. These are challenging times. Inflation has eroded, in just a moment, the spending power of government, but challenging times require decisive action, but this budget simply does not offer those actions. Mr. Swinney.
Deputy First Minister.
I'm grateful to Mr Johnson for giving way so early in his speech. I just want to be clear about his line of argument that he's begun with. Is Mr Johnson saying that should the United Kingdom Government, which has proper responsibility for the management of the energy market, failed to deliver support to the outrageous energy bills that members of the public are facing, that the Scottish Government should use its resources to support such an endeavour? Because that's exactly what he's just put on the record.
Daniel Johnson.
Let me be very clear. I think there is an overarching need to help people lower their reliance on gas. And what I'm talking about is mitigations so that people can actually make their homes more energy efficient. And yet what this government is doing is repeating a scheme that it cut back in September because it wasn't working through a lack of demand. And I'd ask this government, how on earth did it manage to devise a scheme for energy efficiency and insulation at a time of a cost of living crisis fuelled by utility bills and have a lack of demand? And yet they're wanting plaudits for repeating that very budget line that they cut in September last year. It's a nonsense. More of the same, which is all this budget is offering, won't fix the discharge crisis. Repeating policies that you've cut won't fix or help energy bills. And leaving local councils with a £600 million shortfall will not fix a single pothole, reopen a single library, pay for a single extra social worker, or help our kids learn. And ultimately, the so-called National Care Service sums up everything that is wrong, both with this budget and this government. It's a plan that assumes centralisation will solve everything, a plan that is losing the support of those that work in the sector and those that need the sector, a plan that will cost billions and not add a single penny to the front line. And this is a budget ultimately so lacking in transparency, it doesn't even specify how much it contains for this plan. And for those actually delivering care, this budget offers just 40 pence an hour extra, even lower than the 50 pence they got last year, a 3.8% rise, while others in the health sector are being offered 7.5%, and while inflation is running at more than 10%. This just doesn't make sense. We all know the front door of the NHS is jammed because the back door is broken. And why? Because we cannot recruit care workers to deliver the care packages so that people who are well cannot get home. So £12 an hour is not just a budget call, it is a budget imperative to save the NHS. And let's be clear, £12 an hour is affordable. According to Spice, creating a £12 an hour floor to adult social care workers would cost £150 million. Using the government's own figures that they used in 2021, it would be £200 million. And this money can be found. Reallocate the £100 million in the miscellaneous line item in the central NHS budget. Save £100 million by reducing delayed discharge. Pause the National Care Service, which would save £95 million in the coming year. That's where £12 an hour can be found. It is affordable, but instead, this government chooses to pursue a ministerial power grab instead of doing what would be right, paying social care workers a fair wage.
I'm grateful to Mr Johnson for intervening on the intervention. He suggested deleting the miscellaneous line item in the NHS line in the budget. Could he tell us what that would result in cuts to? What services are in that line item?
Well, I think the fact the member doesn't know shows about the lack of transparency in this budget. The budget is there to be done, and let's have the discussion. Let's have the discussion. And there is a wider context here, because there are 300,000 people in the public sector earning less than £15 an hour. You cannot and should not build public services based on low pay. So a budget that doesn't even have a public sector pay policy, let alone a workforce plan, frankly, is deficient. But this budget damages local services. SNP council leaders are clear. The £600 million shortfall is going to cause them to look at 8,000 job losses. And the claim of additional funds, they also point out, is bogus, because it's all so ring-fenced that it's forcing finance directors to look at whether they can continue to afford to deliver statutory services. And the reality is this. It's 15 years of underfunding that has caused this situation, not a single budget or a single budget line. 15 years of decisions from the SNP to cut those frontline services. And the absurdity of that is that these service cuts impact health, learning, poverty, transport, employment and inequality, which will ultimately cost this government more. So what Labour would do is deal with that structural problem, scrap the council tax on domestic rates, replace it with fairer, more progressive levies, and the STUC estimate that could raise as much as £450 million to do so. But instead of a plan for local government, all we have is vague promises of a Concordat Mark II. I'm afraid I don't have time to take another intervention, Mr Kerr. In conclusion, we do live in challenging times. Resources are tight, but challenging times require decisive action and a clear plan. But there is no plan from this government to deal with the NHS crisis, no plan to secure vital services delivered by local government, no plan to help people manage their bills. And just like this government, this budget provides nothing new, no new answers to the challenges that people up and down Scotland face here. Its priorities are wrong, and that's why Scottish Labour will vote against it. Thank you.
Thank you.